We are back here in studio with Terrence Deyalsingh, Minister of Health. Good morning.
Good morning, Lisa.
Morning. It's the first time you're on the set of
Yeah.
TTT, brand new TTT.
And I don't know what you and Carrie put in your coffee this morning for all this energy, but I want some. I hope it's legal.
No, it's all legal.
It's legal stuff.
You seem to have it already.
Right, so good.
I think it's
I like the energy on the set.
Thank you so
Excellent.
much. And that's what we really want to do.
Carrie laughing.
He's always laughing.
You're sure you're legal, eh?
He's very legal.
All right.
Minister, you know, we've been talking about mental health,
Yes.
but more specifically with the recent flooding, we want to talk about mental health with regard to post-trauma.
Yeah.
Tell us what are some of the...
What the ministry is doing after we respond to physical health, get people back up on their feet, what is going to happen after these floods, especially with the 1 week anniversary coming up?
Right.
People are going to start to relive those nasty experiences. And the people who were most affected, like in Madras Road, St. Helena, Greenvale, they are going to start to suffer from post-traumatic stress disorder, which is going to manifest itself in a variety of ways, from physical pain, physical muscle tightness, jaw tightness. Children are going to start, whenever a thunder shower comes now, children are going to start to get scared because they are going to relive this in their memories. And we are starting at the ministry to receive that surge and influx of people who will have this delayed reaction a week and two after. That's when you start to see the mental health issues start to surge.
How is the ministry preparing for this?
Good. So what we have in 2016, we trained about 200 psychological first aid people. The same way you have first aid for a cut or a bruise, you have psychological first aid. So we trained about 200 people in 2016. We are now bringing those people together and to have them go out into communities.
So is it at the mental health, the clinics? Is it at the clinics or are they going to the communities?
You could go to any of your health centers. You have to remember, most people who have suffered this trauma will get through it.
Right.
A small percentage will need more advanced care. For the majority of people, simply talking through the experience, having a listening ear, whether it's from your family, your community, from your imam, from your pundit, from your priest, that will be enough. But we have to cater for those small percentage of people who may need some therapy. So you can go to your primary healthcare physician for a referral. You can come to your health center. We have 100 and something health centers, and you can get a referral if you need more advanced mental health care. It is very important for people who have been traumatized to realize that it's okay to feel the way you are feeling. It's okay to feel depressed.
Because some people put a stigma or taboo.
And it's okay to feel angry.
Yeah.
It's okay. All these feelings are okay. What's not okay is that you refuse help. You have no one to speak to talk it through. So we are putting all those facilities in place for people who need that type of care to be able to access it via the health centers. You can talk to a nurse. You can talk to your doctor. And if you need to be referred, we will have you referred.
And this is at no cost?
No cost.
Across
This
Trinidad and
is
Tobago.
totally free across Trinidad and Tobago.
And in terms of follow-up, is this a one-off or would they be facilitated with the service for as long as necessary?
No, for as long as necessary,
Okay. Yeah.
for as long as you need this type of emotional, psychological, psychosocial support, it is going to be there. And we are working in tandem with the Ministry of Social Development and Family Services because they also have psychologists on board. So those two ministries are working together. We also want to work with the Ministry of Education because children, when they start to go back out to school, they are going to relive this thing. So we have to provide that type of safe environment for them to verbalize their feelings.
Yes.
Because the worst thing, Lisa, is when you have these type of feelings and you can't verbalize it. The first stage in recovery is to verbalize it. Admit we have a problem. Admit I need help. Admit I've been traumatized. And let them bring the resources.
What about family members noticing symptoms? So you may not have suffered it, but you went to help. And you're noticing it and people are keeping it bottled up inside. What do you suggest to those family members to help their family and friends who would have...
Good idea. Good thing. Go to your nearest health center. Speak to the primary care physician. speak to the nurse and you will be directed.
Yeah. So encourage them to go.
With your coping mechanisms, how we cope with this thing. The basic coping mechanism that we could tell the country, and this is going to be difficult because some people were totally devastated.
Oh, yes.
Lost everything.
Everything, yes.
So it's easy for me to stand here and say this, but I am going to say it. One of the best ways to recover from this trauma is to start back as far as humanly possible, some sort of daily routine. Human beings are creatures of routine. I just heard you on Carrie say you wake up 3 o'clock in the morning. That's a routine. Whatever you all put in your coffee that have you all hyper like this, that's a routine. You're laughing. But get back into your routine.
Yes.
We are creatures of routine, and that takes away from the images in your mind about the trauma and devastation that took
Well, I'm
place.
very happy. I know people on social media were asking, okay, would there be counseling for the victims? And I'm very happy to hear that it's available nationwide. Breast Cancer Week. We're celebrating Breast Cancer Awareness Day on now. So it's our day on the 31st of October. Of course, this is Breast Cancer Awareness Month.
So before we go to breast cancer, give me 30 seconds. Leptospirosis, flood-borne disease. Folks, for those of you who have been flooded out, do not touch rats, dogs, cats, cattle with your bare hands.
Even if it's your pet?
Even if it's your pet, because these pets carry the leptospirosis bacteria. Use gloves, use plastic bag your hand. Do not touch dead animals with your bare hands. That's the best way of getting leptospirosis.
What is leptospirosis?
Leptospirosis is a bacteria carried by rodents, cats, cattle, and so on, that will live in your soil, gets into floodwaters. If that gets into your system, you can die from a bacterial infection. That's number one. Number two, Lisa, as the floodwaters recede, they have been receding, it leaves back mud. The mud starts to dry out, and then what you have? Dust. In that dust, you're going to have viruses, bacteria. People who are prone to asthma or other respiratory diseases, cover your face with a simple $2 mask, available in any hardware, any pharmacy. Take basic precautions to prevent yourself from contracting diseases like leptospirosis, like asthma, and other waterborne and airborne diseases.
Is the ministry prepared to deal with, therefore, an increase in diseases through airborne?
Yes, we are.
Because, and do we anticipate an increase across persons, even those who were not affected by the flooding, given that?
We do. So we are making extra bed space available because we will get a surge from next week. We are anticipating a surge from next week. So we are putting all steps in place.
Okay, but we can take our own precautions at home.
Please. Okay. So breast cancer.
Yes.
I have to congratulate you. Give me a 5. Give me a bounce. I see you have volunteered to have a breast cancer examination done live.
Yes, a mammogram and an ultrasound,
Excellent move, very progressive. Youth are really leading the way. And breast cancer is one of the top 5 cancers that the Ministry of Health is paying attention to. For women, it's breast, cervical. For men, it's lung, prostate. And for both men and women, it's colorectal.
Right.
So that's the top 5 cancers we are paying attention to with our non-communicable diseases plan.
Well, it's Breast Cancer Awareness Month, but we will do what we can for all cancers. We've been talking to Carrie and Rishi about prostate cancer, and I believe we have a conversation about that on Monday from the ministry. But I want to thank you, and please look out next week, Wednesday. Yes?
Take it easy.
And we're having Breast Cancer Awareness Day. Great. But Minister, such a pleasure having you in
to be
studio.
Here. All the best.
And we're going to cross to Carrie.